Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. In today's podcast, what I want to talk to you guys about is really how do you know if you have Hashimoto's? Or what does it mean if you have positive thyroid antibodies? Okay, so I want to talk to you about the thyroid antibodies, the TPO antibodies, the thyroglobulin antibodies, which are the most commonly found antibodies. And they're what actually help us determine if you have Hashimoto's thyroiditis or not. It's really, these are really important markers that help us to really make a more definitive diagnosis on what's happening to you and what you're experiencing. So some of these words, for a lot of you, they're going to be familiar. Thyroid peroxidase antibodies and thyroglobulin antibodies. The thyroid peroxidase antibodies are also called TPO, just as an abbreviation, TPO antibodies, and the thyroglobulin antibodies are often referred to as TG antibodies. Okay, so what does this all mean? Well, when you get diagnosed with Hashimoto's, how you actually get diagnosed is that you have to have a combination of things. First of all, for it to really be Hashimoto's, you have to have positive TPO antibodies or positive thyroid peroxidase antibodies. This can be determined through a simple blood test, okay? Any doctor can order it. A lot of times your physicians, general practitioners will not order it because in many cases it's not determined to be medically necessary. Now hopefully that's changing and it's going to be a lot easier to get those tests, but we've just observed after working with thousands of people that it is something that is very commonly denied as far as insurance goes, just because they say it's not medically necessary. And the reason they determine it to be not necessary from a medical perspective and therefore deny payment on it and make you responsible as the individual is because it doesn't change your general practitioner. It doesn't change their treatment plan. It doesn't change what they can do to help you. They want to help you. They want to help you. They're doing their best to help you. But the problem is that thyroid peroxidase antibodies or even thyroglobulin antibodies don't change what the doctors are going to do from a traditional medical approach, from an allopathic approach. In most cases, what they're going to do is they're going to recommend to you and give you a thyroid hormone replacement if necessary. If your TSH, which is your thyroid stimulating hormone, is elevated. Okay, so if it's above the lab range, then that's when they're going to consider hormone replacement, the thyroid hormone replacement therapy, as an appropriate way to try and support your thyroid hormone levels. But notice that thyroid hormone replacement is the only tool that they're going to utilize. Now, it's a very valuable tool. However, it doesn't do anything to address the reason that your immune system is attacking your body. Okay? So I hope that, think about that for a second. When you have positive thyroid peroxidase antibodies, TPO, or you have positive thyroglobulin antibodies, the TG antibodies, it means that the immune system is attacking the TPO, which is an enzyme inside the cells of your thyroid, and also the TG, the thyroglobulin, which is a protein inside the cells of your thyroid. They're required, both of those things are required for the manufacturing of your primary thyroid hormone, T4. Okay? This is really important for you to understand because your immune system is attacking these tissues and destroying them. From a traditional or an allopathic medical perspective, what they're going to do is give you thyroid hormone replacement if appropriate, if determined by TSH levels In the majority of cases, that's what's going to dictate whether or not they prescribe anything to you. And that is, oftentimes, if you think about it, not oftentimes, all the time, that does not do anything to address the factors that drive the autoimmunity, right? So what's actually causing the body to attack the thyroid, to attack the TPO and the TPO enzyme, to attack the TG protein? What is causing that, right? Well, it's not a deficiency of thyroid hormone, but they give you the thyroid hormone because they know that one of the outcomes, one of the things that occurs after you've had this prolonged attack against the thyroid, against this enzyme and this protein, is that the gland gets destroyed little by little, and that it ultimately, it most often results in decreased thyroid hormone output, or a decreased capacity for your thyroid to actually produce thyroid hormone. So it can create hypothyroidism, which is not something that we can have. I mean, it is something that will cause significant decline in function and health long term. So they are, and I'm, anytime people ask me, do you think it's a good idea that I take thyroid hormone replacement? If your doctor determines that you need thyroid hormone replacement, then you need to take it, because they're looking at your levels and they're trying to determine if you're hypothyroid. And let me tell you, if you're hypothyroid, meaning you have low thyroid hormone activity, then listen to this, guys. Every single cell in your body requires thyroid hormone to function, to have normal metabolism. Now, that just doesn't mean calories, that means normal function. So every single cell, from your brain cells to the cells in your toenails, every single cell, every single gland, every single functioning, the smallest building block of your body, the cell requires thyroid hormone. So how in the world can we do this, guys? How can your body function? You will have quick and rapid decline of every bodily function and system if you do not address this basic need, this basic requirement, which is adequate thyroid hormone levels. And I think that's a really, really important point. So I am a huge advocate of not being hypothyroid. Okay, I'm a huge advocate of having adequate thyroid hormone levels at the most basic level, at the most foundational basic thing that you do. That is something that you have to have. It's not worth it, guys. Sometimes people will discuss and they'll talk to me and they'll say, I just don't want to take medications. Well, I mean, I don't either. I don't want to take medications either, but if there's a hormone that's vital to life that my body is not producing because of this process, then I'm going to take it, okay? And I'm going to work very diligently to address the factors that are driving the autoimmune process. Why is my immune system attacking my thyroid peroxidase and my thyroid globulin? Why is that occurring? I'm going to work very diligently to address those factors that are driving that process. And then I'm going to see what my body can do. I mean, maybe there's a chance that the gland can repair and regenerate. There's some evidence suggesting that's more and more of a possibility. So those are all the things that I'm going to, I would do. I would look at all those things and I would work to get my body as systemically healthy as possible. So, just full body health, just work on supporting my immune system, my nutrient status, healing myself. That's what we try to help people do. I try to help people figure out what's going on in my practice, figure out what is happening, and we formulate specific plans to address their unique problems. But it's a really important topic. I wanted to talk about it because understanding, first of all, what are these? What does it mean if I have high thyroid peroxidase antibodies, these high TPO antibodies? What if I have high thyroid globulin antibodies? Well, first and foremost, it means you have an autoimmune process. If you have high TSH, which is your thyroid stimulating hormone, it's a hormone produced by the pituitary gland, then that is what that is what is used to determine and really give you a hypothyroid label. And that's not the thyroid hormones themselves, but it's the brain's signal to the gland that it needs, to the thyroid to your thyroid gland that it needs to produce more T4 and T3. So this is a really important thing to look at. It's important to understand that if you have these high antibodies, you have an autoimmune process. If you have these high antibodies in combination with TSH, then you technically, that's where we would actually call it Hashimoto's. And that's really important to understand because, my case, I have positive antibodies, but I have normal TSH, normal T4 and T3. So that is called euthyroid. It's called euthyroid. You could call it an autoimmune thyroid. You could call it euthyroid, Hashimoto's. You could call it whatever you want to, but it's not technically Hashimoto's because Hashimoto's is low thyroid hormone, right? Or a high TSH, I should say, with positive antibodies. So it's really important. This is usually where people first find out that they have Hashimoto's is usually when they come in, they have high TSH, the doctor puts them on thyroid hormone replacement, then they go through a period of time where they might feel better, then they feel worse. They may even not feel any different. Take the hormones, not feel any different. They come back for their 6-week or 6-month checkup. Sometimes that's the case. Doctor checks the TSH again, and it is still high. Doctor says, doesn't know what's going on. They try to adjust your thyroid hormone levels. Then something happens. Either you feel better, worse, or no different. You come back in, you get checked again. Especially if it's if you're still feeling worse or your symptoms are persisting. You have weight gain, brain fog, low energy, a lot of different symptoms that are really common with low thyroid function. They check your TSH again. The TSH is high. Then what ends up happening is, you go on this roller coaster. They're constantly trying to adjust your meds. And maybe the doctor is familiar with Hashimoto's and they say, you know what? We keep trying to adjust your medications up and down. I think we need to check your thyroid antibodies and see if you're not autoimmune. They check these antibodies, and if they come back with positive TPO antibodies or positive thyroid globulin antibodies, also guys, TPO means thyroid peroxidase, TG means thyroglobulin, then they say, you know what, you've got an autoimmune thyroid, you've got Hashimoto's, and a lot of times the majority of advice is this. The majority of the advice given is this. They'll say, you're autoimmune, what we're going to do is give you thyroid hormone until the immune system destroys the gland, and then you'll just be on thyroid hormone. But you're going to need to be on thyroid hormone the rest of your life because of this process that's occurring. And it's going to destroy your gland over time, and you're going to need to be on this replacement. And that's what they say. That's the majority of what they're told, but that's what they're taught. It's not that it's, that does happen, but it's usually not as simple of a process. What I mean by that is there's usually a very rough and rocky road towards that end point of ultimate, thyroid destruction and decreased ability of the gland itself to produce your hormone. That's usually a very bumpy and rocky road. And then not to mention, what's probably one of the most important things to mention is that not only do most people not feel well through that process, they feel terrible and they still have a lot of symptoms and it's not really better. They have an autoimmune process, right? When you have Hashimoto's or you have an autoimmune attack against these tissues, well, that autoimmunity can expand to other tissues. So you'll see people develop other autoimmune conditions. You'll see them develop pernicious anemia. You'll see them develop, they may have celiac disease. You'll see them develop other autoimmunity. I mean, lupus and lots of other things can come together or come with this. But that autoimmune process can definitely expand to other tissues and destroy other tissues. It's really important that we look at these autoimmune processes that are occurring and we ask ourselves really serious questions like, what is driving this process? What can we do to try to assist our body in having a normal immune regulatory function? What can we do to help our body heal? And really, guys, it takes I almost don't even like to use the word holistic anymore because it's so overused. But you've got to take a whole person approach. You've got to look at not only laboratory testing, but you've got to look at external factors. You've got to look at things like diet, lifestyle. You've got to look at nutritional status from like a vitamin, nutrient, mineral status. You look at everything that you can to try and determine what's driving this process, right? So we often in our practice, what I help people do is investigate all these different aspects of their life and of their physiology, their chemistry, that could be promoting this autoimmune process. And what we do is we look at this whole picture. We then implement plans and strategies to help people try and heal their body as much as possible and dampen that autoimmune process. And it's a very powerful strategy to help you work on really improving your health and dampening this autoimmune process. We do a lot of lab testing. I do a lot of laboratory testing so that I can see what's happening with the physiology. Because if I can look at your physiology and I can get a better idea of what's occurring there, then I can usually determine if there's something, let's say, if there are food sensitivities, if there are pathogens, which could be bacteria, viruses, yeast, or I should say fungal infections or parasites, if there are environmental chemicals that are driving the process. We get nutrient deficiencies. We get a much better idea of what's going on. Genetics that are having an impact here. This is all very important at getting a more clear picture. Now, when you take that data, that information, in combination with what someone's doing from a dietary perspective, how are they eating? What is their stress level like? What all do they do throughout the day? I mean, how are they sleeping? Do they have meaningful relationships? All these things make a difference because the stress response and all these other pieces, they all come together, to make up you and your response to your environment and ultimately, the things that drive the immune system. So we work to try and figure out as much as we can about all of these processes to help people, become as whole as we can again, to help them try to get their health and their life back. But the main thing I want to talk about today, it seems like every time I get on these podcasts, there's a tendency for me to digress into other areas. But that's kind of how it is because everything is connected in the body. You can't take one thing for granted. You can't go in and say, I've got Hashimoto's, I want to just, look at my blood work. No, there's value in that, but that's just one piece of the puzzle. Your stress response is huge. If you're having an active stress response, that is a major, major problem because having an active stress response drives your sympathetic nervous system, your fight or flight mechanisms. That changes your hormones. That will contribute to breaking down and degrading your function. It's all very important. So it affects the immune system. It affects the endocrine system. It affects everything. So there's a lot more to it than just looking at blood work. There is. You have to consider the whole person. And so anyway, I hope this helps you guys out. I kind of digressed a bit, but I wanted to get into this. I wanted to get into this topic and these issues, especially when we're looking at what is thyroid peroxidase antibodies, or TPO antibodies, what's TG antibodies, what does it mean, or thyroglobulin antibodies, because that's how a lot of people first find out that they've got this autoimmune thyroid process, which is sometimes Hashimoto's. Like me, it's euthyroid Hashimoto's, but this is usually where they first come into this world. So I wanted to make sure we covered those basics so that I helped you guys better understand this and this process and the importance of understanding some of the differentiating factors here. If you guys have questions, comments, please let me know. I appreciate you hanging out with me today while I kind of ramble and think freely. Hopefully it was valuable. And if you have any questions or you need anything, please do let us know. We appreciate you hanging out with us. Please, if there's anything that we can do better, please do contact us directly. Let us know because we do want to do the best job possible, give you guys useful information that helps you. And if you enjoy the podcast, you like it, please do go review it and share it with your family and friends so that we can really change the face of healthcare, because what I'm trying to do is change one person's life at a time. And I know if I can change your life, I can have a positive impact on your family, your community, and then ultimately we'll change the world. So until next time, guys, hope you have a wonderful, wonderful day. Thank you for hanging out with me, and talk to you again soon. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.